Hello, my name is Savannah Trung, and I work as a hospital staffing policy analyst in the Oregon Health Authority Hospital Staffing Program. The Oregon Health Authority Hospital Staffing Complaint System is how Oregon's hospital staffing law, including the updates in 2023's House Bill 2697, are enforced in Oregon. For investigations starting after June 1, 2025, the OHA will provide tools for the hospital to complete, which will help clarify the information gathered, reduce the need for OHA follow-up questions, and provide more opportunities for the hospital staff members to participate in the investigation process. These tools are provided on the first day of the investigation with the investigation needs list. In this video, we will discuss the CNA staffing tool, including when this tool is used, who completes the tool, and how to complete the tool. The CNA staffing tool is used in hospital staffing investigations involving CNA staffing levels. It includes three sections: CNA staffing levels, CNAs assigned to work with specific patients, and CNAs assigned to specific patient care tasks. OHA will start a separate CNA staffing tool for each shift and unit under investigation. So if there are multiple units or multiple dates under investigation, there will be multiple staffing tools included in the initial needs list packet. As you'll see on the next slide, OHA will complete the top section that lists the hospital name, the unit name, the dates under investigation, and the shift and time under investigation. The rest of the tool will be completed and signed by the unit's direct care representative on the staffing committee and the unit manager, or their designees, if either individual is unavailable. The designee must be familiar with the unit's operations and has a similar role to the individual they are acting on behalf of. For example, if the unit's direct care representative is unable to complete the form, the designee who completes it must be another direct care staff member who is familiar with the unit's operations. This slide shows the section of the tool completed by the OHA hospital staffing team, as marked by the 4 red arrows. These sections are in a box at the top of the form with a note in italics indicating that this section is to be completed by OHA. The beginning of the tool also includes instructions on how to complete the form. On this slide, the instructions are marked by the gold star. The instructions indicate that the direct care unit representative and unit manager or their designees must initials and date the bottom of each page of the tool. This slide shows section 1 of the tool, which asks general questions about CNA staffing levels. The direct care unit representative and unit manager indicate in question 1 how many CNAs were working on the unit during the shift and time under investigation. Question 2 asks for the maximum number of patients that were present on the unit during the shift. In other words, if there was a total of 30 patients present at one time, you would enter 30 on this line, even if some of those 30 patients weren't assigned a CNA. Question 3 asks for information about the nature of CNA assignments during the shift and time under investigation. If CNAs were only assigned to work with specific patients, you would complete section 2, but would not need to complete section 3. Conversely, if CNAs were only assigned to specific patient care tasks, you would skip to section 3 without completing section 2. If CNAs were assigned to work with specific patients and were assigned to specific patient care tasks, you would need to complete both sections 2 and 3. This slide shows section 2, which you will only complete if CNAs were assigned to work with specific patients during the shift under investigation. In this section, you will complete one page each CNA who had a direct patient assignment. You will need to attach additional pages as necessary to show the patient assignments for all CNAs on the unit during the shift and time under investigation. For each CNA, include their name, the time their shift started, the time their shift ended. You will also provide the following information in the table: identifier of the patient they were assigned to, such as medical record number, initials, or other appropriate identifier, the time the assignment started, the time the assignments ended. This slide shows Section 3, which you only complete if CNAs were assigned to specific patient care tasks during their shift under investigation. In this section, you will complete one page for each CNA who was assigned to specific tasks rather than individual patients. You will need to attach additional pages as necessary to show the patient assignments for all CNAs on the unit during the shift and time under investigation. For each CNA, include their name, the time their shift started, the time their shift ended. You will also provide the following information in the table: descriptions of the tasks assigned to CNA, identifier of the patient or patients who provide the task, such as medical record number, initials, or other appropriate identifier, the time the assignment started, the time the assignment ended. This page concludes the CNA staffing tool, asks whether additional pages are attached to this packet, and if yes, asks for the number of additional pages attached. The form also asks you to confirm that you have initialed and dated each page, including this one and any additional page. The spaces to initial and date the tool will be in the same spot in the footer for each page of the form. At the bottom is the attestation section, marked on this slide with a gold star. This is the space for the direct care unit representative and unit manager, or their designees, to provide more information about themselves. The two individuals who completed this form will print their first and last name and their job title in the corresponding space. They will also sign the form and write the day signed, with the date including the month, date, and year to complete the form. The CNA staffing tool is posted on the Oregon Health Authority hospital staffing website at www.healthoregon.org/hospital staffing. The Oregon Health Authority hospital staffing website also includes information about hospital staffing requirements and resources, such as FAQs, webinars, and hospital staffing shorts.